Have you ever walked out of a medical appointment feeling unsettled, overlooked, or quietly doubted simply because of your age? For women over 60, this conversation could change the way you approach your health and perhaps even safeguard your future. Today, we are going to uncover 5 surprising questions that doctors sometimes ask. At first, they may sound harmless, even caring, but hidden underneath could be assumptions, subtle manipulation, or age-based bias that can affect the care you receive in ways you might not expect. From quiet tests of your mental alertness to discouraging hints about your future, these questions can influence both your confidence and the medical decisions made about you. Stay with me until the very end, because the 5th question is far more common than you might imagine, and knowing how to respond could protect your dignity and independence when it matters most. Before we begin, I truly appreciate your support. If you haven't already, please subscribe and turn on the notification bell so you never miss a video. And just like always, if you like this video, comment the number 1 below. If you don't, comment the number 0 so I know how to improve for you. Question 1, are you sure you want to know the results? This question often appears in the hushed, clinical environment of a medical office. You might have just completed a screening, a set of blood tests, or perhaps an imaging scan. Then, the doctor pauses, sighs softly, or gives a sympathetic half-smile before saying, "Are you sure you want to know the results?" On the surface, it may seem like a sign of compassion, as though they are protecting you from unwelcome news. But look deeper, and you may discover a different reality. In many cases, this is not about safeguarding your emotions at all. It can stem from the doctor's own discomfort, the pressure of a packed schedule, or even an unwillingness to have a challenging, time-consuming conversation. Delivering medical results, especially when they are complicated or potentially serious, is no quick task. It requires time, patience, and a genuine dedication to making sure you understand. That means translating medical terms into everyday language, anticipating your questions, and walking you through what the findings could mean for your life. Beyond medical skill, it takes empathy and emotional intelligence qualities that not every provider prioritizes or feels able to give in the middle of a busy day. Some physicians use this question as a gentle deterrent, subtly discouraging you from digging deeper. By making it sound as though knowing the details might burden you, they reduce the chance that you'll ask for a full explanation. And if you do not ask, they can avoid spending the extra time clarifying why your liver enzymes are elevated or what that faint shadow on your scan might indicate. Here is the truth when it comes to your health. Ignorance is dangerous. Knowing early can be the difference between tackling a condition while it is manageable and facing it only when it has advanced. I recall a patient named Helen, a 70-year-old retired librarian with a warm smile and an active mind. She had been feeling unusually tired for months. Her former doctor had ordered blood tests, but after glancing at the results, brushed her off with a casual, "Everything's probably fine. Do you even want the full breakdown?" Trusting him, she said no. She left reassured but still exhausted. 6 months later, she came to see me. When we reviewed that same blood work, I immediately saw trouble: dangerously low iron, steadily falling platelet counts, and other markers suggesting a possible bone marrow disorder. Had these findings been addressed earlier, treatment could have started promptly and spared her months of discomfort. Instead, she faced a more complex recovery process. This is not an isolated story. Research shows that withheld information or poor communication between doctor and patient can delay diagnosis in up to 20% of cases, particularly for illnesses like cancer or autoimmune diseases. If you ever hear this question, respond politely but firmly. Yes, I want to know every detail. Please explain what the results mean for my health. Take notes, or, where legal, record the conversation with their consent. Ask pointed questions. What do these numbers indicate? Are there follow-up tests I need? What are the next steps? And if you sense hesitation or evasiveness, do not let it pass. Schedule a follow-up or seek another opinion. Your health is worth the effort. If you're still here with me and finding this advice helpful, type the number 1 in the comments so I know you are still watching. Thank you for giving me your time. Question 2. Do you really want to go through all that at your age? At first, this question might sound gentle, even caring, but beneath the surface it carries a sting of condescension. When a doctor says, "Do you really want to go through all that?" at your age, they are not truly asking about your personal goals, your physical capabilities, or your wishes. They are making a quick judgment based purely on how many birthdays you've had. That is ageism in medicine at its most obvious form. Unfortunately, it is far more common than people realize. Over the years, I have seen this single sentence chip away at patients' confidence, dim their hope, and take away their chances for better health outcomes. Let me share a story that captures how damaging it can be. Eleanor, a lively 71-year-old, started each morning with a brisk walk, nurtured a thriving vegetable garden, and led a weekly poetry group, yet she lived with severe knee arthritis that made every step painful. Hoping to regain her mobility, she consulted an orthopedic surgeon about knee replacement surgery, a procedure known to bring remarkable relief. Instead of explaining the potential risks and benefits, the surgeon's first response was the question above, delivered with a heavy tone that suggested she might be foolish to even consider it. Eleanor left feeling not only doubtful about the surgery, but questioning her own worth. Was she too old to deserve living without constant pain when she came to see me? Her medical profile told a very different story. She had a strong heart, well-managed blood pressure, and an active lifestyle, all factors pointing to an excellent chance of recovery. I showed her research indicating that in healthy older adults, knee replacements can improve mobility and reduce pain in more than 80% of cases. With many returning to the activities they love, Eleanor chose to go ahead with the surgery. 6 months later, she was walking without pain, tending her garden, and enjoying life fully again. This kind of dismissive attitude from medical professionals is not just irritating, it can be harmful. Studies from the National Institute on Aging reveal that older adults who experience ageist attitudes from their doctors are less likely to seek treatments, follow medical advice, or even pursue care in the future. If you ever face this question, answer with confidence, yes, I do want to pursue this because I value my health and my future. Let's discuss the risks and benefits based on my current condition, not my age. Insist on specific, evidence-based information. If the doctor cannot provide it, find one who sees you as a person with goals and potential, not just as a number. Question 3. Have you considered just letting nature take its course? This is one of those questions that can land like a stone in your chest. It's often spoken in a calm, almost serene tone, maybe with a knowing sigh or a look that suggests deep wisdom. On the surface, it can feel like the doctor is offering a thoughtful, even spiritual perspective, but beneath that gentle delivery, the truth can be very different. In far too many cases, this question becomes a convenient escape, an excuse to avoid the harder work of laying out your treatment options, explaining potential risks, or standing firmly as your advocate. What's worse, it is often directed at older women, as if their lives are somehow less worth saving. Now, in genuine palliative care, when a patient is truly at the end of life and comfort is the main goal, this conversation has its place, but I've seen it used far too early. Even when effective, life-prolonging treatments are available, and the patient is nowhere near the end of their journey. Take the case of Laura, an 81-year-old with early-stage breast cancer. She was vibrant and independent, volunteering at her church library, meeting friends for weekly card games, and managing her own home. Her primary doctor, however, looked at her birth date before anything else and said, "At your age, maybe it's best to let nature take its course." Laura was never offered a consultation with an oncologist. No one mentioned a lumpectomy, a simple, minimally invasive surgery with high success rates and a quick recovery time for her stage of cancer. She wasn't given a chance to weigh the facts. The suggestion had nothing to do with her prognosis and everything to do with an assumption about her age. When she came to me, worried and unsure, we sat together for over an hour. We reviewed her scans, discussed survival rates over 90% with treatment, and talked through her personal values. Laura chose surgery. She recovered quickly and, 5 years later, she's still living fully, enjoying her community and her garden. Statistics from the American Cancer Society confirm that older women are less likely to receive aggressive treatment for breast cancer, even when their health supports it. The phrase "let nature take its course" often hides a doctor's reluctance to commit time or resources to a patient they've mentally written off. If you hear this question, don't just nod. Ask directly, are you saying there are no effective treatments left? What would you suggest if I were 50? Is your advice based on medical evidence or my age? And if the answers are vague, seek another opinion. If you're still here with me and finding this helpful, type the number 1 inch, the comments, so I know you're still watching. Thank you for being here. Question 4, who's making your medical decisions for you? At first glance, it sounds like a perfectly harmless question. If you have come to an appointment with a spouse, adult child, or a close friend, it might seem natural for a doctor to ask. But the truth is, this question can carry implications that go far beyond casual conversation. Sometimes it is used as a subtle way to test whether you are still capable of making choices for yourself without telling you that is what they are doing. Imagine sitting in a small, brightly lit exam room. The doctor flips through your chart, then looks up with a smile that doesn't quite reach their eyes. They ask the question lightly, but their tone is deliberate. So, who usually makes your medical decisions? If you hesitate for a second, maybe you are trying to recall the exact dose of a prescription, or perhaps you simply want to answer thoughtfully. That moment of pause can be misread. In their mind, your hesitation might signal cognitive decline. And if you are sitting next to a family member, the doctor's attention may shift to them almost immediately, as though you have silently handed over the authority to speak for yourself. This is not always intentional cruelty. Sometimes it stems from deeply ingrained assumptions about aging. Older adults, especially older women, are often viewed as less decisive or less capable, even when there is no real evidence to support that belief. Over time, those assumptions can rob people of their autonomy in subtle but deeply damaging ways. Consider the story of Margaret, a 75-year-old woman known for her independence. She pays her bills, shops for her own groceries, cooks every meal, and takes her medications without help. On a rainy day, she asks her son to drive her to a checkup, simply to avoid walking on slippery sidewalks. During the visit, the doctor asks about her medication routine. Margaret pauses for a moment to picture the bottle in her mind before answering. Without missing a beat, the doctor turns to her son and asks, "Do you usually help your mother make medical choices?" In that instant, Margaret feels the focus shift away from her, as if her role in her own health has been downgraded. That one small exchange can have lasting consequences. Notes might be added to her medical record, suggesting possible cognitive issues, or requires family input for decisions. These vague remarks may seem harmless on paper, but they can influence future care, insurance approvals, and even legal matters. Once a label like that appears in your file, it can follow you for years, shaping how every new healthcare provider interacts with you. A study conducted in 2023 found that roughly 15% of older patients had ambiguous comments in their records that hinted at reduced mental capacity, even though no formal assessment had been performed. In some cases, these unverified notes led to limited treatment options or unnecessary interventions, all because a provider assumed diminished competence based on impression rather than evidence. Of course, there are situations where involving family in decision-making is both appropriate and necessary, especially if a patient has been formally diagnosed with cognitive decline, but such involvement should always be based on transparent discussion, clear medical evidence, and respect for the patient's dignity, not assumptions formed in a single conversation. If you ever encounter this situation, you can respond with calm clarity. I make my own medical decisions. Though I value my family's input, is there a particular reason you're asking? This reinforces your role as the primary decision maker while still showing openness to collaboration. You can also request to review your medical records after the visit to ensure no inaccurate or misleading notes have been added. Your voice matters in every appointment. A single question should never be allowed to quietly strip away the control you have over your own health. Question 5. Are you still driving? At first, it sounds like a simple, harmless question. Driving is an ordinary part of life. And in certain situations, such as when a person has serious vision loss or medical conditions like epilepsy, doctors do need to check whether it's safe. But sometimes, the context and timing of this question hide a more troubling intent. If you're at the clinic for something completely unrelated, perhaps a blood pressure follow-up, joint pain treatment, or even a skin irritation, and suddenly the doctor asks, "Are you still driving?" It's worth stopping to think. This may have nothing to do with your actual driving skills. More often than not, it's a quiet way to probe for cognitive decline, test your independence, or evaluate your decision-making ability without openly saying so. It's a test you never agreed to, and the consequences can be lasting. Many physicians use this as a shortcut to judge memory, as spatial awareness, and self-perception. Assuming your driving reflects your overall mental state, rarely do they explain what they're doing. If you answer yes, they might write in your file, "Pacient still drives," may not recognize limitations. If you answer no, they could note, "Loss of independence, monitor for decline." Either way, your response can be shaped to fit a narrative of frailty, often without a single formal assessment. This is particularly common for older patients, especially women who already face stereotypes about aging and capability. Take Mary, for example, a 78-year-old who was sharp, active, and fully independent. She volunteered at her local library, managed her own finances, and enjoyed an active social life. During a routine visit for her arthritis medication, her doctor casually asked, "Are you still driving?" Mary explained that she drove confidently during the day but preferred not to drive at night because of headlight glare. The doctor nodded politely, but weeks later, Mary was contacted by her insurance company. A note in her medical file read, "Surprised patient still drives. Monitor for cognitive concerns." That single, casual question without context triggered a chain of events, including an expensive and unnecessary driving assessment. Was the doctor surprised simply because Mary was in her late 70s, because she wore glasses, or because she made the wise choice to avoid night driving? This issue is more widespread than many realize. A 2022 report from the American Medical Association revealed that older adults are often inappropriately questioned about driving, with women over 75 targeted most frequently. In some states, a doctor's report based only on suspicion can trigger mandatory driving tests, license restrictions, or even guardianship discussions, all without standardized cognitive testing. The deeper problem lies in what this question represents: a subtle, ingrained bias that equates aging with decline. Driving is more than transportation. It's a symbol of autonomy. Questioning it without valid reason can feel like an attack on freedom. If you are asked this, respond clearly and assertively. "Yes, I drive, and I'm confident in my ability." Is there a medical reason for this question? If you choose not to drive, state your own terms. "I prefer public transit, but I remain fully independent." Always ask how your answer will be recorded and review your medical notes to correct any misleading statements. Above all, Choose healthcare providers who judge you by your health, not your birth year. That concludes our look at 5 surprising questions doctors may ask, questions that could influence not only your health, but also your independence, particularly for women over 60. My hope is that this discussion has given you a new perspective on how subtle bias or unnecessary pressure can slip into medical conversations, and the confidence to stand firm in making choices for your own well-being. What is one insight from today's video that you will put into action? Perhaps it is speaking up when you sense hesitation from your doctor, or asking directly for clear explanations and full access to your results. I invite you to share your thoughts and personal experiences in the comments below. And if this video offered value, please like, share, and subscribe so you can continue receiving empowering tips to protect your health and live your later years with confidence and vitality.